This is Keena. I'm going to be doing my opioid crisis presentation. Here's my audience. It's my 5 pupils. Okay, now let's get started. Lights. Thank you, ma'am. Okay, so opioid crisis. Okay. Alright, so by the end of the presentation, my objectives are, by the end of the presentation, the audience will be able to identify state facts of the national opioid crisis. They will be able to identify the impact of the opioid crisis on the nation. They'll be able to identify signs and symptoms of opioid abuse and abusers. And they'll be able to explain different things that the FDA and the USDA is making plans to stop or help with the opioid crisis, and also different things that I can do just as an individual, as a care worker, and y'all as well with helping with the opioid crisis. Okay. The opioid crisis, I found different definitions for it, of course, and everybody has their own opinion to it. The opioid crisis, one that kind of summed up all of it, is the increased writing of the prescription opioid medications that lead to the widespread misuse and abuse of opioids before it's understood that these medications could even be highly addictive. At least 3/4 of an opioid pill abuser and almost all heroin addicts got hooked. Listen to this, without even having been prescribed an opioid medication for any kind of injury or illness. I thought that was very interesting there. Some stats that I have found, in 2016 is what this has come out of, and there was 116 people die every day from the opioid-related drug overdoses. 11.5 million people misuse prescription drugs in general. There was 42,249 people die from opioid overdose. 2.1 million people had an opioid use disorder. 948,000 people used heroin. 170,000 people used heroin for the first time. 2.1 million people misused prescription opioids for the first time. 17,087 deaths attributed to the overdosing on commonly prescribed opioids. There was a $504 billion in economic costs. There was 15,469 deaths overdosing just on the heroin, and then there was 19,413 deaths attributed to the overdose on synthetic opioids other than methadone. So that's going to be like fentanyl and the methamphetamines. Okay, so different things that healthcare is trying to impact, or what the opioid crisis has on the impact of healthcare, meaning like cost and finances and even government. The JCAHO has a new pain management standard to where when a patient comes into the emergency room or hospital in general, the physician is to treat the patient's satisfaction. That's how the hospital is being reimbursed. So JCAHO has these new pain management centers, which is for patient satisfaction. So therefore, the doctors are prescribing more medicines to satisfy the patients. Not to mention, a lot of patients, I know even in the low economic places, has a lot of Medicaid, excuse me. So the Medicaid is paying for all these opioid prescriptions. Well, won't we just make Medicaid buckle down and do a 90-day rehab or something to at least slow down the Medicaid being able to pay for all the prescriptions? And then evidence shows that persons with abuse or misuse prescription opioids incur higher costs, of course, for the healthcare resources that we use, because they're trying alternate methods to treat the pain, and it's not helping because all they want is the opioids, the seekers anyway. And then opioid abusers are 4 times more likely to visit the ED. They are 12 times more likely for hospital stays, and 3 times as many outpatient visits than any non-abuser. Some signs and symptoms of somebody that is having opioid abuse. You've got the noticeable euphoria, the high state. You've got the marked drowsiness or sedation. You've got some confusion. Their pupils are going to be constricted. You'll have slowed breathing, intermittent nodding off, shifted moods. You got the doctor shopping. We all know opioids cause constipation, so they have constipation. Family members might notice that there's extra pill bottles turning up in the trash. They'll typically have social withdrawal and sudden financial problems. Different ways that we as healthcare workers can try to make a difference. We can try the alternate pharmacological interventions such as a physical therapy, or even prescribing anti-inflammatory or something more milder than go straight into the opioids. They have different prescription drug monitoring programs that can be linked to the medical healthcare records that we use. So we can see about getting prescription drug monitoring. Even physicians have access to certain prescription drug monitoring programs as well. And then we can start reporting anybody that comes in with overdoses, and we can start screening people that we see having signs of opioid abuse for meth or fentanyl or etc. The other ones. Okay, so in the nationwide, in 2017, the U.S. Department of Health and Human Resources, they declared a public health emergency, and they announced a 5-point strategy to combat the opioid crisis, and the 5 points are as listed. I have improving access to treatment and recovery services, promoting use of overdose reversing drugs, strengthening our understanding of the epidemic through better public health surveillance, providing support for cutting-edge research on pain and addiction, and advancing better practices for the pain management. The FDA has also come up with some, as I mentioned earlier. The FDA is trying to advance the treatment for pain through improved sciences rather than prescribing opioids. The FDA has improved 6 of their opioids already with features that are less likely to cause the abuse. The FDA has created an action plan for opioids, and just a few that I mentioned, they had several mentioned. Just a few where they were developing warning and safety information on the opioid labeling as they get them from the pharmacy, and support more treatment options for opioid substance abuse and to prevent opioid overdose deaths. My references that I got some of my information from was the government, the HHS government, the WHO, and then an article that I found on another website. So thank you for your time.